Right, thank you everyone for joining us this afternoon for Medicaid and Children's Health Insurance Program CHIP renewals on Tuesday, November 13th for our lunch and learn. And our guest presenter is Patrick from the Center of Medicare and Medicaid Services. Our disclaimer: the ARC of Lehigh Northampton County's Advocacy Department does not employ lawyers nor provide legal advice. This training or any others provided by the ARC's Advocacy Department does not constitute or imply the endorsement, recommendations, or favoring of the providing party or any employers or contractors acting on its behalf. This webinar is being provided for educational and informative purposes only. Thank you for letting me share that. And now it is my pleasure to introduce our guest presenter. Patrick Hamilton has been the Center for Medicare and Medicaid Services, CMS Philadelphia Field Office since October of 1998. Sorry if I'm aging you at all. He is currently the Special Assistant to the Regional Administrator of CMS Philadelphia. In that role, he is responsible to contribute the developmental and implementations of CMS Philadelphia's external affairs and public information campaigns to strengthen the healthcare services and information for Medicaid, Medicare, and marketplace consumers, as well as the healthcare providers who serve them. He serves as a part of the CMS Philadelphia's leadership team and works in partnership with regional, state, and local organizations to support and implement CMS's strategic plan goals, objects, and cross-cutting programs. Previously, Patrick worked in the areas of providing outreach since 2002, where he had services as an outreach specialist to provide in the state of Delaware, Maryland, Pennsylvania, Virginia, and West Virginia, as well as District of Columbia. Patrick received a Bachelor of Arts in Political Science from St. Joseph's University in Philadelphia and a Master's in Public Administrations from Villanova University. Thank you, and the Zoom is yours.
Great, thank you. And what I didn't tell Kodi when we were preparing for this is when I started at CMS in 1998, I was only 10 years old. So you're not aging me at all. So that's all good. It's great to be with you again. My name is Patrick Hamilton. I'm the Special Assistant to the Regional Administrator here in the Philadelphia Regional Office with Sharon Graham. You may have had some work, may have worked with my colleague Monique Scott, who would have been here today. She is our guru when it comes to Medicaid renewals, Medicaid and CHIP renewals, unwinding, redetermination. We have a lot of words that we've been calling it for the past almost year now. But today actually ended up being a very busy day. We had about 6 or 7 different events that 3 of us had to cover. So I was more than happy to step in when Monique was not able to be here. And this is a really important topic. So we're going to be talking about what do we mean by Medicaid and CHIP renewal or redetermination or this continuous improvement condition, and the end of the public health emergency and getting back to normal operations, and what that means for folks who may not have gone through the renewal process in Medicaid or CHIP in the last 3 years, or if at all, if they were newly enrolled into Medicaid during the public health emergency. So we here not only at CMS, but HHS, the Center for Medicare and Medicaid Services, is the largest department within the department, or largest agency within the Department of Health and Human Services. We just want to make sure that we are utilizing all of our partner contacts, all of our partnerships to make sure that we're getting the word out through all means possible so folks know, number one, that this is happening, and number two, what they need to be on the lookout to do. And then number 3, be able to make sure that no one lapses in coverage if they are found out to no longer be eligible for Medicaid for a number of reasons. And we try to get them into other health insurance. And we'll talk about the different ways that that can happen. So just as Kodi did her disclaimer, I also have to give my own disclaimer whenever we give A presentation on Medicare, Medicaid, or Marketplace, policies subject to change. It's current as of the time of this presentation on November 14th at 12:41. However, the contents of this document do not have the full force and effect of law and are not meant to bind the public in any way. The document is intended only to provide clarity to the public regarding existing requirements under the law. You go to the policies and the regulations to get the actual law. This is just summary information. And this communication was printed, published, and produced and disseminated at U.S. taxpayer expense. So let's talk about where we were before March of 2020, what happened in March of 2020, which we all know what happened, but what that actually meant in terms of Medicaid and CHIP. CHIP is the Children's Health Insurance Program. It is a very long acronym, so from here on out, I'm just going to say CHIP. So whenever I say CHIP, it is the Children's Health Insurance Program, and Medicaid and CHIP are really in sync in that they are funded the same way, and it's a federal-state partnership, much like the Medicaid program is. So February 2020, in the before times, there were about 71 million people who were enrolled in Medicaid. And every 12 months, there is a process called renewals, whereby states had to review the information of the people that they were enrolled in their state's program to make sure that they were still eligible, that they met all the eligibility requirements. And in any given year, up to 17 million people could lose Medicaid or CHIP coverage. That does not mean that they became uninsured, but they were no longer eligible for Medicaid or CHIP because they could have gotten a new employer. They could have gotten insurance through an employer-sponsored plan. They could have aged into Medicare. Medicare is the federal program for folks who are predominantly for people who are 65 or older. There are other ways you can get in Medicare, but about 90% or so of the people in Medicare are 65 or older. Or they may have gotten a plan through the health insurance marketplace. And we're going to be talking a lot about the marketplace during this presentation. So when you hear that X million people may lose Medicare coverage, that does not necessarily mean, and what we are trying to do in presentations like that is to make sure that they don't become uninsured, because there are other pathways that these folks can get health insurance coverage. As of March of 2023, which was the end date for what was known as the continuous enrollment condition, and I'll explain what that was in a second, we went from 71 to 93 million people covered. And at one point, the programs that my agency oversees, Medicare, Medicaid, CHIP, and the health insurance marketplace, covered almost 1 in 2 Americans in terms of their health insurance coverage. So as you can see, very big, very important program. So on March 31st, 2023, this continuous enrollment condition, which basically was put into place during the beginning of the Public Health Administration in March of 2020, that basically told the states, don't do any of your renewals, don't do this redetermined process, because during the pandemic, we want to make sure that as many people stay covered so that they can get the health insurance coverage that they need, and it made sense. And in order to help the states, they got additional funding through their federal matching. So we called it was the continuous enrollment condition. So the condition for the states to get that extra funding was that they continued to keep folks enrolled. As we announced the end date of the public health emergency, which eventually would have become May 11th of this year, there was a law that was passed at the end of 2022 called the Consolidated Appropriations Act of 2023. And in that, the end of that continuous enrollment period was set for March 31st. So it was a little bit before the end of the public health emergency. But the message to the states was, starting April 1st, we're going to begin the process of doing those renewals and removing folks from Medicaid or CHIP coverage if they no longer meet the requirements. So I think I basically gave all of that. That's basically what's on this slide. So they got increased funding. The Consolidated Appropriations Act of 2023 ended it on March 31st. If you've been paying attention to this, we had a number of terms that we used this. We first called this Medicaid unwinding, because we were unwinding all of the provisions that we put into effect at the beginning of the pandemic. Then we called it Medicaid and CHIP redeterminations because we started the process of redetermining whether people were still eligible. And now we're calling it Medicaid and CHIP renewals. It sounds nicer. We want to see if we can renew your coverage. There are ways that we can proactively, without getting the consumer, the person with Medicaid involved, continue to be renewed into coverage automatically, and I'll explain how that happens. The states, we are working with the states. As I mentioned, up to 15 million people could be determined to not be eligible for Medicaid or CHIP anymore. Again, we want to make sure that that does not scare you or spook you. That does not mean that there's going to be suddenly 15 million people uninsured. So what we're trying to do is to find pathways to other coverage. So as we return to normal operations, as I said, Medicaid and CHIP coverage, the states have to renew their coverage for everybody by the middle of 2024. Now, there is a timeline, and the timeline is available on the link that you will receive when you get a copy of the slide presentation. And we've been working with the states long before March 31st or long before May 11th to make sure that everything was put into place. Now, again, if you're following the news, there are some pockets of the country where states are having a more difficult time with this. Pennsylvania, I can tell you, is doing relatively, like I said, whenever someone loses coverage, it's not a good thing. But in scope of the 50 states, Pennsylvania is one of the better states because they had a system that was set up. They also have a state-based exchange when it comes to the marketplace called Penny. That is for folks that need to buy health insurance in the marketplace. Many states, there are 32, use the federal platform, but there are some states that set up their own exchanges as early as 2013 when it came into fruition. So Pennsylvania has a really good system in place, and we in HHS and CMS have a good relationship with my colleague Monique Scott with the folks at Penny. So any hiccups that happen between trying to transition people from Medicaid to Penny, we're able to address. The Biden-Harris administration is committed to maximizing the number of people who have affordable, high-quality coverage, and we want to make sure that people stay covered either through Medicaid, because people could be redetermined and find out that their resource levels are such that they still are eligible for Medicaid. Also, during the pandemic, there are states that have expanded Medicaid coverage, meaning more people could qualify because it's always based on the federal poverty level. And many states have increased the percentage of the federal poverty level that people can be deemed eligible for Medicaid in their states. As a matter of fact, I think it is North Carolina is in the process of implementing that starting December 1st. I think, and I don't know if I had this on the slide, but there are 38 states that have expanded Medicaid coverage. So again, that's kind of one of the safety nets that we hopefully will have in place so that people do not lose coverage. So we, like I said, we've been working with the states, 22 of them, I think the last time that we checked, 22 of them are using other state-based or other needs-based programs or resource allocated-based programs that they use to determine eligibility for that program to automatically deem people eligible for Medicaid. So for example, on the slide, we're talking about SNAP, which is a Supplemental Nutrition Assistance Program. There are some states that will say, if you continue to be qualified for SNAP benefits, then you will continue to be qualified for Medicaid. It's not all states, and not all of them do the direct one-to-one. If you qualify for this, you use this, but there are states that will use the SNAP resource information that's already on hand to make the determination about Medicaid, and that does make a big difference. And then there are a number of states that over 40, there are some, many people get their Medicaid benefits through what are known as Medicaid managed care organizations, and they have databases of addresses. The addresses, and one of the first things that we ask all of our our partners in our organizations that are actually doing the field work, the messaging is actually quite simple when you're talking to people with Medicaid. The first of which is make sure that your information is up to date with the states on the state system. Something as very simple as not having a correct address on file is not going to get that person the renewal notice when it comes. forget about filling out the renewal notice. Well, first of all, like paying attention to the mail, if it actually did arrive to the correct address, paying attention to the mail, opening up and realizing that they need to do something, or they could be without health coverage. So doing things just like sharing database information so that we have up-to-date information for addresses is very beneficial, and I've been working on it as well. We've also come up with some very good suggestions that we have strongly suggested our states undertake, such as use the entire 12-month period to do your renewals. When this first started, there were a couple of states that said, we're going to get this done in 6 months. And I think they found out quite quickly that that was probably not going to happen. So you have 12 months. And I think that most states now have decided that they are going to use 12 months. And you go back to the timeline that was on the previous slide. And then you can take a look at these resources as well. And these are specific things that CMS and HHS sent out for guidance. There was something, and I don't know if it's included here, but we came upon some very specific systems issues in some of the states. And what we did is we compiled all those issues together, and we created another letter, I think, that went out from the secretary that said, oh, by the way, Wisconsin, for example, had this issue with their system, just as a heads up type thing. So we're doing a lot of information sharing so that no one is really left out in the cold. So talked about the actual timeline for when this is going to be done, but what is the actual renewal process? And I told you that there are some ways that it can be done automatically, and then there are other instances where we need the person with Medicaid or CHIP to actually take action. So generally, states need to renew eligibility for everyone in their program once every 12 years for MAGI beneficiaries. And I just had a discussion as to how we pronounce that acronym. Some people call it MAGI, some people say MAGI. I'm going to say MAGI, but that basically means modified adjusted gross income. And that's most people that are on Medicaid. So it's going to be most children, parents, pregnant individuals, and other non-disabled. And then for non-MAGI individuals, those include people who are over 65, because you can be dually eligible for both Medicaid and Medicare. And then also people who are blind, who have blindness or other disabilities are considered non-MAGI. So what states first must do is to try to make the determination with the information that is available to them without asking for any additional documentation from the person with Medicare. And that is known, and if you're, now we're getting into the weeds, as an ex parte renewal. Sometimes it's also called auto renewal, because you're going to be automatically renewed because we have the information on hand. Called passive renewal, administrative renewal, but it's all basically the same thing. Now, if we were able to do that ex parte renewal and someone can be redetermined eligible based on that information, then the state's going to send a notice saying that you are still eligible. You don't have to do anything except if there are corrections to the information that we were not aware of, send those corrections back. If the state tries to do that type of renewal and they can't find a person eligible that way, then the state must send a renewal form to request the needed information. So there's a form that each state sends out that says, we're missing this information. We can't make a determination on your eligibility. Please send it back. These are the forms that are going out that we have to make sure that people are paying attention, because number one, if they don't have their correct address, they're not getting the form. But if they're not getting the form and fill it back or fill it out and send it back within, I think, 30 days, then they can be removed from Medicaid, from the Medicaid rolls. If after they send in the information and they are determined that they're no longer eligible, and again, they could have gotten a job since the last time the eligibility check was done, and they are now receiving employer coverage, and maybe they didn't know they had to cancel Medicaid, or they bought a plan in the health insurance marketplace, or they turned 65. But if none of those things have happened, then the process begins making the transition from Medicaid, state Medicaid, to the marketplace. And in Pennsylvania's case, like I said, the transition happens, I believe, a little bit easier because we have a big state-based program. The next couple of slides are going to be a cornucopia of resources that are available. We have toolkits, communication toolkits. They are audience specific. We have a faith-based toolkit. So if you'll indulge me, I'll just go through and show you what's available. The fastest way to look for this stuff is just to go to medicaid.gov/unwinding, and you're going to find all of this stuff. But I want to show you some of the goodies that you're going to find when you go there. These are the opening, I think these are still the front pages of medicaid.gov unwinding, and you're going to be able to read through all of the resources. The renewals is and it's consumer facing too. So it is all the CMS websites, by the way, have been revamped within the last year to be more reader friendly and user friendly. So if you've never been on a CMS website, then you're not going to know the difference. But if you have been in the past year and you go back and you take a look at it, I think you're going to be pleasantly surprised. Even the provider stuff, I don't think we have any providers here. The provider stuff hasn't even been made to look prettier. So it's not just gobs and gobs of policy. So it is consumer facing. You can actually click on your map to get specific information. So you just figure out where your state is. If Pennsylvania is here, click on Pennsylvania. It takes you right down to that information that you need. CMS recently added new pages to house all the data we're gathering and posting related to the renewal process. I'm not exactly sure of the time frame, but I know that we are posting probably, what are we in November? I'm going to say like 3 to 4 months back, the most recent renewal numbers in terms of the number of renewal initiations that have been done, the number of actual renewal, like we renewed Medicaid, the terminations or the transitions to other coverage. And I think that is maybe 3 or 4 months behind, I think, which actually is not too bad for CMS data, actually. Of course, we're dedicated to make sure that people stay connected. So we have campaigns and we have many, many campaign meetings throughout the week that we're all involved in. We're meeting with partners, we're meeting with navigators. We are coordinating with our marketplace teams to make sure that those transitions I told you about are taking place. Our communication strategy centers around making sure that individuals either maintain enrollment through Medicaid and CHIP, or that they enroll in the best type of health coverage that they are eligible for at the time of redetermination. Yeah, so I mean, I've said this before, but since each state has its own communication plans and tactics, you can find that as well. And again, Pennsylvania is very proactive as it works in conjunction with Penny. We have a specific outreach and education resource page. So if you're doing any train-the-trainer, for example, you want to go to that part of the communications toolkit and you can find other stuff. And I'm going to show you also some stuff that you can actually print out. We have fillable flyers. So we have approved flyers that you can put your organization's information. So for example, if you were with a faith-based organization and you wanted to put somebody's contact information because you are the person that's going to be point of contact for your congregation, for example, on Medicaid renewal or marketplace enrollment, you can put your contact information and have CMS approved material for you. We also are doing things in a number of languages. So before, a lot of it was just English and Spanish. But select resources, as you can see, are also in many different Asian languages as well. And we also kind of cultivated the messaging so that it wasn't just simply a translation of what was written in English for a specific population, but we worked to make sure that we weren't, like I said, not just translating the English, but when we were translating into another language, making it in a message that was relevant and understandable for the community that we're talking to. So for example, the Chinese community, we have to make sure that when we're translating the message into Chinese, that we're doing it in a way that is respectful of their community. Some of the things that are in the toolkit, and again, these are all things that are downloadable and that you can plop right into your materials, a drop-in article. And that basically tells the very basics of what is going on with renewals, and also the steps to make sure that your address is up to date, answer the renewal letters. And if you are a parent and you are not eligible for Medicaid anymore, your children who are under 18 may still be eligible for CHIP. So it's still, you still have to answer the renewal form. Text messages. So if you are texting, if you have a robust community that you are sending messages out, we have specific texts here with links to the Medicaid unwinding website that you can send. Social media graphics, if you're doing Facebook, I don't know if anyone's doing TikTok and talking about unwinding on TikTok. I'm, since I've been here for 25 years, I'm not the TikTok guru, but we do Instagram, Facebook, YouTube, things of that nature. So we have social media graphics that are downloadable, and then the partner tip sheet that basically says, here's a cheat sheet if you come into contact with somebody who finds themselves out of Medicaid coverage, what they need to do. More graphics are here. Here's the fillable flyer that I told you about. So if you want to, for example, leave this in an office or a place where there is traffic where people would be getting this information and you want to personalize it and put your own information in there, you can do that. You can put your own organization's website in there, phone number. We also have QR codes. We have gotten pretty good at the practice of using QR codes so people can just point their phones and get their information as quickly as possible. And a lot of fact sheets. And the fact sheets, again, are, we try to keep them, and I think these are all one-pagers because nobody likes to flip a page when they have to read stuff. And again, these are pretty reader-friendly. Most of this, I think, is at the 6th grade level. That's what our aim is, so that nobody is completely turned off when they are reading this information. It's important stuff. And we want to make sure that we can keep people's attention long enough that they are getting the basics of what they need to do. And of course, there's always, the chance for fraud. And I'm going to be talking a little bit about fraud because I'm going to touch about the Medicare Open Enrollment when I'm finished here. And the fraud messaging is the same regardless if we're talking about Medicaid, if we're talking about Medicare, especially rampant marketplace, there's always fraud. So want to make sure that you say no to scams and that you have just some very basic tips. We're never going, Medicaid's never going to proactively call you. They are never going to ask you for certain information. When we talk about Medicare Open Enrollment in a few slides, I'll go in a little bit more detail. But again, it's important to make sure that everybody is aware that there are some ne'er-do-wells out there as well. Specifically, we have messaging for kids and families. I know that we're working with school districts, for example, to put messaging in kids' backpacks so that their parents know that this is happening and that there is action that they may have to take. And then we have a specific toolkit for younger children. And again, that would be for school-based and early education care settings. And this would be specifically CHIP coverage, which is going to be for the children's health insurance program. And we work a lot with faith-based organizations all over the country. And here in Philadelphia, we have a strong partnership with a lot of our faith partners. And I was really happy to see this. So we have specific, I think this is the first year that we had specific faith-based messaging and a faith-based toolkit. So we're actually telling, the sermon, here you go. We're giving you messaging that you can deliver from the pulpit. I know that when we had a bigger team in Philadelphia, we went to church. We actually went to church on Sundays and we would talk at the pulpit. So now, with travel, people are still skittish about doing in-person events. We decided that we were going to give the information to the folks that are in the faith communities, and we are sharing that with them. And then specifically for populations, again, for messaging for social media and outreach, we have in many of our campaigns in CMS, what we call targeted audiences, and those are audiences that have traditionally been underserved or underheard. A lot of them are, ethnic or racially based, such as Black Americans, Latino, Hispanic, Asian Americans, Native Hawaiians, Pacific Islanders, but we also reach out specifically to folks with disabilities, with LGBTQ+ audiences, rural communities, we consider target audiences. So we are really expanding the reach in terms of doing direct outreach and messaging to those audiences as well. You can also order stuff from us if you want hard copies. This is where you want to go to the CMS product ordering website. I'm not going to go through all the stuff, but everything that I showed you and more are available there. So if this is something that excites you and thinks that you can use that to spread the word, please feel free. Everything is free. And as you can see, everything is in English and Spanish, and then there are some additional products that are available in other languages. And I think that this is just a sampling of some of the other languages. There are other products that are available in other languages. So basically, the message right now is we're asking all of our partners, both public and private, to do everything in your power to make sure that the message gets out, because we want to have people stay covered. At the end of the day, that's what it's about. Whether it's through Medicaid, whether it is through Marketplace, whether it is through employer-sponsored coverage. And again, the messaging is quite simple. Update your contact information with your state Medicaid or CHIP agency. Pay attention to your mail. Respond to the renewal form. Again, if that ex parte or passive renewal was not able to make the determination, you're going to get a form in the mail. Make sure you respond to it. And as I mentioned, parents, even if you don't think that you're eligible, you receive a new job, you still may be able to get more affordable coverage for your children through CHIP than through other coverage that you may be receiving. And of course, consider other coverage options. Again, I sound like a broken record. Medicaid, Medicare Marketplace or employer-sponsored coverage. I will tell you, for the Marketplace, we are right now in open enrollment. We're in 2 open enrollments. I'm about to talk about Medicare Open Enrollment, but we're also in the Marketplace Open Enrollment, which started November 1st and goes through January 15th. Now, the good news is that anyone can, either if they're in the Marketplace, they can make changes now, or if you're new to the Marketplace, you can sign up for the first time now. But what happens if you are still receiving Medicaid, and then you find out, let's say in April, you no longer qualify? Usually, you would have to wait until the next open enrollment period, which would be until next November 1st. But there is what is called a special enrollment period for anybody that is determined not to be eligible for Medicaid any longer, regardless of when that happens. And they have 63 days to sign up for a Marketplace plan. So you don't have to worry about open enrollment. We just so happen to be talking about it during the current open enrollment period. But for people that fall into this situation, they're determined not to be eligible for Medicaid, they get a special enrollment period. And then thanks to the Inflation Reduction Act, which was the big law that was passed last year, there was a lot of Medicare and Marketplace provisions in there. They're very beneficial to consumers. There's something in the Marketplace called premium tax credits. And that's just a fancy way of saying it's the financial assistance to make sure that your monthly premiums are low. And initially, those tax credits were going to expire in 2023. But thanks to the Inflation Reduction Act, those tax credits are extended through the end of 2025. Which means is that with the tax credits, and then there's additional cost sharing reductions, if you qualify for both of those, there's a good chance that you could find based on your income levels and your resource levels, if you qualify for the tax credits and you get those other cost share reductions, there's a good chance that you could get a very, very affordable Marketplace plan, maybe in the neighborhood of like $10 per month. So always consider, all of those options. All right, so we're going to switch gears just for a bit. I'm not going to talk too much about Medicare Open Enrollment, but I just want to make sure that everyone knows that we are also in the midst of Medicare Open Enrollment. This started a little bit earlier. It starts every year on October 15th, and it goes through December 7th. So this happens every year. This is an evergreen campaign. But again, because of the Inflation Reduction Act, if you have people that are eligible for Medicare, or if they are thinking about starting their Medicare coverage, I want to make sure that you know all of the new provisions based on the Inflation Reduction Act that are coming into fruition. Well, some came into fruition this year, but there are more next year in 2025 and 2026. So very basically, 2 ways you can get your Medicare coverage. Once you start, you can get Original Medicare, which covers your Part A, which is your hospital insurance, and Part B, which is your medical or doctor's insurance. And then if you want drug coverage, then you sign up for a supplemental prescription drug plan, which is called Part D, for which you pay an additional monthly premium, usually. And then you would most people get a supplement or a Medigap policy to fill in the holes for co-payments and deductibles and things like that, which is an additional monthly premium. The good thing about original Medicare is that you can see any doctor or go to any hospital in the United States that takes Medicare. Now, you will have generally a 20% copay. Medicare generally pays 80% of the costs, and then you pay 20% out of pocket, and that's why folks get that Medicare coverage. The other option is Medicare Advantage, and these are those commercials that you see with Joe Namath and Medicare Martha and the woman who yells at her husband about the Medicare coverage. That's Medicare Advantage. So that's basically like a bundled package. So you get your Part A benefits, your Part B. Most plans have your Part D benefits, and you might get other stuff that traditional Medicare doesn't cover, or original Medicare, such as dental, health, or dental, hearing, and health and vision. Not all plans do that, but you'll see that advertised. Now, the thing that you need to remember or to be aware of with Medicare Advantage is that you can only see doctors that are in the network that particular plan has contracted with, and there could be the need for prior authorizations for services or for specific drugs that you may be prescribed. So those are the things you really have to weigh when you're deciding if you're just going to go with traditional Medicare or Medicare Advantage. As I mentioned, it runs from October 15th through December 7th. So this is for people who are already in Medicare. So these are, this open enrollment period is not if you're new into Medicare. When you are newly eligible for Medicare, you have another, what's called initial enrollment period, and that's something different. We're not going to talk about that today. Now, the period we're in now is specifically for people that are already in original Medicare or who already have a Medicare Advantage plan, who want to either go from original Medicare and sign up for a Medicare Advantage plan, or vice versa, or change Medicare Advantage plans. Why would you change a Medicare Advantage plan? Your doctor may have left the network. Drugs may no longer be covered because the formulary changed. So that's what you use this period for, October 15th through December 7th. As such, you get an annual notice of change. So in that notice of change, things such as your costs for 2024, any changes to the rules as it relates to your benefits or coverage. As I mentioned, the list of drugs could have changed. So these are the things that you have to pay attention to. And then after renewing it, then you can go on to the Medicare Plan Finder, which I'll tell you about in a second. And then you can do a comparison, do your shopping, and make changes by December 7th. Which will be implemented on December 1st. So basically, I told you, I'm jumping ahead. You can either join a new Medicare plan, join a new prescription drug plan. So that's another thing I didn't mention. So if you're in original Medicare, I told you you're getting your A and B, you have to sign up for a prescription drug plan. You can also use this open enrollment period to switch drug plans as well. Or if you have never had a drug plan before, because it's not mandatory, only if you want drug coverage, then you can sign up for the first time for a Part D plan. Now, the plan finder is at www.medicare.gov/plan-compare. So we just call it the compare website. And that's basically where you can put in a list. Well, first of all, it's area specific, so you put in where you live, and then the drugs that you were taking. And I believe you also put in the doctors so that you can determine whether or not they're in the network. I'm not sure about that. One thing I wanted to point out here as it relates to the Inflation Reduction Act. So hopefully you've heard in the news that the Inflation Reduction Act this year capped insulin prices for all covered insulin products at $35 a month. And also the vaccines that are covered, that are recommended by the ACIP, and then some other goodies that were Medicare Part D specific. Last year, when the law passed too late for the plan finder to reflect the information. So we had to come up with a workaround so that people could get a true sense of what they would be paying for their insulin products. Those IRA improvements have now been built into the plan finder so that when you go in and you do your shopping, then, for example, if you are taking insulin, then the true cost of the insulin with the new caps will be reflected. And then also, I think it goes without saying, if you're happy with your current choice, you do some shopping, you said, you know what, there really isn't anything that's better that's out there, and my drug formulary hasn't changed, my doctor's not going, or you don't have to do anything, and then, you know, we take a look at it again for you next October. Again, with the Inflation Reduction Act, a couple things that are upcoming in the next couple of years, again, as it relates to people with Medicare Part D. Starting next year, people who have a very high prescription drug cost will no longer have to pay anything once they hit what's called the catastrophic phase. So when the Part D benefit was created, and also there is, in 2025, we're eliminating the coverage gap, which is sometimes called the donut hole. So if you were familiar with Medicare Part D, the donut hole was this, basically this hole, this gap in coverage where you had to pay 100% of out-of-pocket costs, and then once you hit a ceiling, that's when you got into that catastrophic phase. And then I think the copay at the time was, I think it's still only, it's 5%. So even that 5% catastrophic out-of-pocket cost is going away in 2025, and then that coverage gap or the donut hole is going away. I'm sorry, the catastrophic phase is going away in 2024. The donut hole coverage gap is going away in 2025, as will a limit on out-of-pocket costs for your drugs at $2,000 a year. That's starting in 2025. You also may have seen on the news that we are starting the process of Medicare drug price negotiations. The first time that the government is going to be negotiating directly with drug manufacturers for the price of drugs. We announced the first 10 drugs that will be subject to price negotiation. That announcement came out, I think, in September. Might have been a little bit earlier in the summer. Earlier this year, we have agreements from all 10 drug manufacturers of the drugs that were chosen that they're going to enter into negotiations with CMS, with HHS. And then there's a bunch of other stuff that has to happen, but the prices for those negotiated prices for those first 10 drugs will go into effect in 2026. So a lot of good stuff coming down the pike for Medicare Part D, thanks to the Inflation Reduction Act. So very quickly, there is a Part D, again, for Medicare, a program called Extra Help, or also the Low Income Subsidy. And it was a rather, it was a smaller group of folks who qualified for that based on resource levels. So that is also expanding due to the Inflation Reduction Act. So people who have the lowest income and resource payments will have no premiums or no deductibles, and very small or generally no co-payments. But since we increase the percentages, there are going to be people who have slightly higher income levels who will also benefit from some extra help. And then what was known as partial extra help, that's going to be going away either next year or 2025. So anybody who qualifies for the low income subsidy is going to get the full extra help. Now, you can automatically qualify for the full extra help if you're a full Medicaid, if you have full Medicaid coverage and Medicare. So you may have heard the term dually eligible or dual eligibles. As I said, you can be qualified. You can qualify for both Medicare and Medicaid. And if you do, then you automatically get this extra help. If you get supplemental security income through a disability or SSI, or if you get help paying your Medicare Part B premiums through a program that's called the Medicare Savings Program, then you can also get extra help. If you don't qualify, or if you don't meet the criteria listed on this slide to automatically qualify, you can still apply for it and get the extra help. And there's a number of ways that you can do that that is on that slide. These are the 2023 extra help co-payments, but we're at the end of 2023, so we won't pay attention to those. But here is some information starting in 2024. People qualify for extra help will pay no more than $450 for a generic drug, $1120 for each brand name drug. And again, if you have, if you're really in that area where you have 100% federal poverty level, then it's, in most instances, will be no cost out of pocket. Again, beware of Medicare fraud. Can't say this enough. Do not answer the telephone. Wait, what are the things I have down here? The plans, so here are some of the messaging. I want to make sure that that everyone understands this. So Medicare.gov 100 Medicare, of course, are the official sources for information. We have put more rules in place that the Medicare Advantage plans have to follow when they are marketing to you. Plans are allowed to send you emails or direct mailings, but they are not allowed to call you or visit you in person to market their products without your permission. It's important to remember that Medicare will never call you. If someone you don't know calls you about Medicare, hang up. It took me 2 years to get my mom to hang up the phone when somebody called her because she became eligible for Medicare a number of years ago. Thankfully, I worked for CMS. She would get a phone call and she would call me right away. And I said, for 2 years, Mom, hang up the phone. Don't talk to anybody. If you have any Medicare questions, they're going to mail you, basically. Same thing with Social Security. No one is going to call you. They do all of their official communications through mail. So make sure that you hang up. Plans we send emails also have to give the option, the unsubscribe option or the opt-out action as well. And again, make sure before you enroll in a Medicare Advantage plan that you understand what the plan covers, how it affects your other benefits, whether it covers the drugs that you have to take and whether the doctors are in the network that the plan covers. We will finish up with just a couple of resources. Again, Medicare.gov and 1-800-Medicare. They're 24 hours a day. Those, again, are the official sources of information for Medicare. And then hopefully, for those of you who are that have come in contact with folks on Medicare, that they have the Medicare Youth Handbook. It gets mailed to every Medicare beneficiary at the end of the summer because it has state-specific plan information, so folks can at least start doing the plan comparisons and the shopping when they get their book. Electronic versions of the Medicare Youth Handbook are available online as well. But this really, especially as it relates to the plan finding for either Medicare Advantage plans or Part D plans, it's meant to be a starting point, and then you go on to Medicare.gov and you do comparison in your shopping, etc., etc. All right, that is all I have. I think I spoke for about 50 minutes, but I would appreciate if you could do just a quick evaluation. So what we do, I'm in the Office of Program Operations and Local Engagement, and then within there, the Local Engagement Administration. And our role is basically doing this external partnership, outreach, education, and getting in front of an audience whenever we have the opportunity to do so to make sure that they have the information that they need either for themselves, for their family members, for their partners, or for the people that they serve, for their organizations. As such, we want to make sure that the messaging that we are doing is hitting the mark and that we are giving you the information that you need. So this is just like a very quick, I think there's maybe 7, I don't even know if there's 7, I haven't looked at it lately. So you can do, again, I told you we use QR code now. I actually did develop this QR code and I like it because the little dinosaur has not gone away. So they haven't replaced it yet. If you don't use a QR code, then you can click on this link when you get the PDF. The links, I think I'm going to be sharing a PDF version of the slide deck. The links should work. So if you don't want to use your phone, you can just go in and do that. And I would just ask that you put the number 3 Medicaid unwinding presentation so that we can make sure that we can pull out the evaluation specifically for this evaluation or for this presentation. And I think I'll just give you another second if you want to hit the QR code and my contact information. Yes, I always say, especially when I'm talking in front of a live audience, and now the most important slide in the entire slide deck, how you get in touch with me after I leave today. So if I can't answer your questions, you know how to track me down to make sure that you get all the information that you need after we part ways today. But I'm happy to take any questions. And like I said, if I don't have specific answers, I don't want to say, I think this is the answer. I will specifically say, I will research it and I will give the answer to Kodi and I'll ask Kodi to make sure that it gets back to our participants today.
Thank you so much for that presentation. Great information that we can send out to our attendees. So thanks again. I'm going to end the recording.